Dr. Kyle Loveless here, and I want to shoot a real quick Facebook Live video, but also a video that we can use to help educate people in general about migraines. Okay, migraines are a huge thing, and it seems every day we're seeing more and more patients with migraines, and it's something that we've been extremely successful with on helping patients recover from migraines. Okay, and first thing I want to start out with, I'm going to try to make this short and sweet so you get good information from it that you can actually use. Is the first thing I want to talk about is what is a migraine. A part of their life, and it's something that's common to them, or they call it normal, and it's something that they can handle, especially if it's only like once a month or every other week and they seem like it's not that big of a deal. One thing I want to tell you is if you're dealing with migraines, the research has shown that you have an increased chance of heart issues, increased chance of cancer and other things down the road because of not because of the migraines, but because of what the underlying cause of it is. So the first question you got to ask yourself if you're dealing with migraines isn't just how do I get rid of migraines, but what's the cause? Okay, and what they've shown is that almost 90% of headaches in general, but also migraines, stem from cervical issues or neck issues. Okay, and I'm going to talk about that a little bit. But today, the top 4 things that you can do that you want to look at first when it comes to migraines. Okay, I'm going to make this real straightforward today. The first thing that you want to look at when it comes to migraine is what we call food sensitivities. Okay, so we have this concept of sensitivity to foods, and it doesn't have to be some allergic reaction. Okay, it doesn't mean that you eat peanuts and your whole face swells up and you have to get an EpiPen or anything like that. It can be simple, just a sensitivity to it. Some of the most common foods that you're going to be sensitive to, that almost, I would say all of us are, but some people get real reactions severe enough as like migraines, are going to be things like dairy. And the number one reason is because our dairy today isn't what it used to be. It's pasteurized, it's filled full of hormones and all kinds of other stuff. If you want to know more about dairy, do the research on it, but it's super bad for you. It really isn't very, very good for us. It can absolutely lead to migraines, among other things like digestive issues, which in return can lead to migraines. So there's a lot of variables in this, but food sensitivities are huge. Other things that many people are sensitive to are going to be things like we think of like peanuts, almonds. Many times it's things like what's called that have lectins in them. Okay, and lectin are things that we think of are good, like nightshade vegetables have lectins in there. Things like tomatoes, peppers, and lectin is a natural pesticide within a plant. Okay, we've heard of gluten, which can absolutely lead to health issues as well. But lectin is a natural thing within within wheat, it's within tomatoes, and a lot of other nightshade vegetables. Also things like almonds have them. So it makes it harder for your body to digest. Many people will respond negatively to these and they'll see things like migraines. Okay, so again, food sensitivities, and there's testing you can do for that. My recommendation simply is start to do a takeaway diet. Pull things out of your diet and slowly add them back in, see how it affects your migraines, and that can be a first step. Okay, so look at food sensitivities. Number 2 is going to be, let's see what I have written down here. Sorry guys, I have it written down. Oh, hormone imbalances. So hormone imbalances, we mentioned that, will affect blood flow to the brain and affect other things that will actually lead to migraines. Okay, and so the only really way you can tell if you have hormone issues, you can tell by symptoms many times, but there's certain testing you can do to find out. A good example of someone who had migraines from hormones is someone who had migraines their whole life and then as soon as they got pregnant no longer had them. Or someone who never had migraines and then as soon as they got pregnant started having migraines. That's going to be a hormonally based migraine, or even someone who's had them their whole life, went through menopause and never had them, or vice versa. Okay, so it tells us that changes in your hormones are starting to cause migraines. But again, what that ultimately means is that the migraines are coming from hormone issues which are affecting blood supply to the brain. Okay, narrowing arteries, causing constriction, putting the body into a fight or flight response, stress response. So hormone imbalances can be key. You want to make sure that you get testing on that to find out. But that's it, right? And there's a lot of things you can do for your hormones, but that's for another day. Okay, and number 3 is going to be deficiency. One of the main deficiency is magnesium deficiency. Okay, magnesium deficiency absolutely can cause constriction of the blood vessels, keep them from relaxing, decreasing blood supply to the brain, and causing migraines. So supplementing with a magnesium supplement can be very effective. It's absolutely 100% of the time someone has a migraine, one of the first things I ask is, have you tried magnesium? Sorry guys, there's a lot of noise going off in the background. We have construction all around our office today. But yeah, try magnesium. One of my favorites is something called Magnesium Calm. Okay? That's an easy one. Magnesium calm, you can get any health food store, but it will let you know. And the cool part about magnesium is when you take it, if you take too much, you get diarrhea, and you're not going to overdose on it, but you'll know if that's the cause. You'll start to see migraines disappear if you take magnesium. Okay, so many times magnesium deficiency can be the cause. The final one I want to talk about today that you absolutely, I always say do this first because it's so important. It almost always relates back to this, and this is to the spine, but have your spine evaluated. So let's just say spinal migraines, things that stem from the brain, the upper part of the neck. And let me show you this. I got a model here to make this really clear on how this works. So you have a spine here, okay, and this is a spine model, and you see this red thing right here, this red artery? So that goes through the top bone of the neck, and that's a vertebral artery, and it feeds the blood supply to the brain. What can happen, or at least this is many times what will happen, is two things. Number one, if you have a rotation or subluxation or out of alignment of the upper part of your neck, it can do two things. One, it'll create a stress response, putting your body into a fight or flight mode, causing restriction. Or two, it can actually affect the artery directly or affect the nerves going to the skull, to that area around your head, causing muscle spasms, and in return causing a migraine. So there's multiple ways this works, but so many times I'll tell you that we're above 90% on getting rid of migraine headaches just by moving this. It's usually then, for me, for what I've seen and also what the research has shown, is that most of it stems back to this. Some of the latest research within medicine to help with migraines is to actually put something within the body that will stimulate your parasympathetic nervous system and slow down your sympathetic nervous system. And that sounds great because it's going to get rid of the cause, which is a stress response in the body, and lower down your balance out your nervous system. The problem is you're putting something in your body. Ultimately, what we found is if you make sure your spine is moving properly and working properly in the proper alignment, that in itself is going to put you out of that stress response, and you're going to be able to relax. And your brain's going to, your mind's, your skull, the muscles in your head are going to relax, and migraines will actually disappear. I got a great story for you guys, and then we're going to close up. A patient of ours, her name's Mel, and she's been coming to our office now for, I think, about 2 years. And when she first came in, it was daily migraines. I mean, to the point where she would have to go home from work, literally have to turn the lights out. The person I told you about in the beginning, okay, major headaches there. And so she just kind of lived like this. She would take her Excedrins, her ibuprofen. She did the major medications that the doctor put her on. By the way, going to the doctor, here's the thing, guys. For migraines, many times they'll give you something like a CAT scan, which is tons of radiation to the brain. Okay, so she did her CAT scans, lots of radiation to the brain. I think it's 1 out of 11,000. Super small percentage. 1 out of 11,000 of these CAT scans actually shows a tumor, and that's why they're doing it. So most of the time, it's something you should never do for a migraine, but that's typically what they do. And I'll tell you that a medical doctor only has about 2 hours of headaches studying or headache education. A neurologist has about 4 hours. And that's what, you can look this stuff up. This is real. I've actually done the research on this to know that number. So it's not really the expert in it. What I've learned, because so many people come in for headaches, is that if we can get your spine moving, your body will heal. So for her, we took x-rays, we saw the upper part of her neck was an issue, started getting her adjusted, her body started to heal. Her migraines decreased. They didn't disappear, they decreased. We started seeing less often. She got down to where she was only having 1 migraine a month, way less frequent or way less severe. And she stuck with that for a while, and she was continuing to come in about once a week. And finally, this last, about a week ago, she came to me and said, hey, I don't know if I told you, but I haven't had a migraine since January. Really cool. So right now we're in July. She hadn't had a migraine since January, and this was a daily factor. So the key there is we got her spine moving, but we also gave her body time to heal. So many times when we do things with our health, we dive into all these things that we can try, but we never actually give ourselves a time to heal, and we just say, oh, that didn't work. So maybe you're someone out there who you've been to a chiropractor before, you've tried the magnesium, right? You've tried different things like food sensitivities, and you still have migraines, and you say, well, oh, it just doesn't work. Well, maybe you didn't give it enough time. Or maybe you didn't go, maybe the doctor that you're working with didn't really get the things moving that need to be moving, right? Or maybe you didn't take enough magnesium, I don't know. But the first step is to find the cause. Okay, make sure you're looking at the cause, not just covering it up. If you're someone that's taking Excedrin, ibuprofens, major neurological medications that they put you on, you're going downhill fast. This stuff is horrible for your health and it will affect you in the long run. The key is not just covering it up. I know it's painful and I know you got to get through your day, but finding the cause. Keep searching. You will find someone that can help you. If you live in the Charlotte area, we are happy to help you at Queen City Health Center. Hey, if you don't live in this area, say, hey, I have migraines. Can you help me? Find somebody. We have doctors all over the country that are not directly connected to us, but we know that can help you. So we'd love to connect with them as well. Okay, so hey guys, like this video. Hopefully you liked it. Hopefully you got something out of it. Share it. People need to know this stuff. Most people go to the doctor for a migraine. They get a horrible medication. They don't get better, and it's just a downhill battle. It's super unsuccessful in the medical model. You got to pull them out of that by sharing this stuff. Okay, so like it, love it, share it, and yeah, we'll continue to share this stuff with you. You guys have an awesome day.